for coming. We're going to be getting some weather, so we've closed the shades so you don't have to look out there and contemplate the snow coming. Welcome. My name is Laura, and I'm going to be leading our discussion today. So what I'd like to first do is ask you, and I think some of you are professionals here, you've got your name tents already started. So if you could put your name on both sides of the name card there, and I will do the same. So in case I forget my name on this side, all of you can remind me what my name is on your side. See that okay? And if you can just tilt your name tents a little bit towards me so I can see all of you there, that would be great. So we're going to be together today for about 55 minutes or so, and we're going to have a discussion, and some of you might have done this before, but I want to just do a little bit of housekeeping before we get into introductions and things like that. There is a camera in front of us here, and that's there just to make sure that we get all of your insights appropriately, and we're hearing what we need to hear from all of you, and just to make sure that we're not missing anything. And I do have some colleagues over there as well who are going to be taking some notes. I too will be taking some notes as we move along. I will take notes. I might be doing some things on the flip chart and kind of up and down. Hopefully I won't make any of you seasick as I'm going up and down. So anyway, so we can get started here. So today we are going to, first I'd like to wish all of you happy Valentine's Day. Hope you men remembered. So today's Valentine's Day and also Heart Month, so it's a very appropriate day for us to get into a discussion about some of your thoughts around healthcare. So that's what we'll be talking about today. And so what we'll go ahead and do is I'd like to go around the room and learn a little bit more about you. And here's some of the things that I would like to understand from you. First of all, I'd like to, even though we have your name on the tents, tell me your name. And I'd like to get a sense of how many times you might have had some type of health-related appointment in the last 12 months. And give me a sense of who you might have seen and where you might have had that visit. And then give me an idea of what that visit was like. What was like? Was it good? Was it bad? Was it something in between? Give me a sense of that. Okay, does that make sense? Yep. Harold, would you like to get us started off today?
Do you want number of actual appointments, the actual times we've seen a doctor?
Just roughly how many times in the last 12 months you might have seen a physician?
Mine is probably about 25. My most recent, I had in October, I had a brain surgery. I had a tumor, and it was taking up 3/4 of the left side of my brain.
Oh my.
And it would take me an hour to tell you afterwards all the examples of what I found out was how bad I really was, but it's come around, and I knock on wood, and I'm much better now.
Seems like you're doing fabulous.
Thank you.
Thank you for telling us that.
But you have the monthly appointments. I mean, before this, you have the monthly appointments with the family doctor. I see my ENT doctor twice a year. I have my blood checked every so often, and so the number of appointments is just for myself, let alone for my wife.
Okay. And just thinking about maybe the last few visits you've had, how would you rank them? Good, bad, somewhere in the middle?
They've been good. I think this thing has taught me now that I have to be more proactive, I believe, in doing things and asking the doctors how often, when you want to see me again. I don't let them just make the decision, I ask them. And if I get a medication, I'll ask them about it or something of this nature. So I keep logs and charts and all this kind of thing, and I'm diabetic, so I mark my blood sugar every day, and
Well, you're definitely diligent in taking care of yourself, so again, thank you.
You have to, I found out you have to be that way.
Sure.
Especially after spending 22 days in rehab after my surgery. You get to see a lot and learn a lot, and I've come to accept a lot of people before this happened to me. You know, I'd wonder, why did that happen to them, or why are they like that, or whatever. And I see now that it can happen to anybody.
Sure.
All
Well,
this stuff that they used to read about, that, you know, this and that, I'd say it'll never happen to me. I don't say that anymore.
Well, so a little bit of what you talked about with regard to being proactive, we're going to just put that on the side for a little bit, and we're going to get back to that and talk about that a bit more.
Okay.
All right, Esther, right?
Esther?
Esther?
Yeah, it's a Hungarian spelling, but it's Esther.
Esther, thank you. So Esther, tell me a little bit about what your
Well, I
experience
don't
has
think
been
I'm
like.
going to give you too much because the doctor tells me you have to come at least once a year. You know, because otherwise I'm not going to renew your prescription. So
That's
once
a good
year
thing,
I
so you're healthy, in
well,
other words.
I
That's good.
try.
Well, good, so in the last time you went to see your doctor, what did you? Last year, so was that,
On a fall, last year in a fall.
how did you feel about that appointment in general? Good, bad, okay, somewhere in between?
Good, I love my doctor, he likes me, and
Well, that's good.
even in between, they give me a call, come and show up. Otherwise, I cannot say anything bad.
Well, that's good. Well, thank you. Joy, tell us a little bit about you.
I've seen the doctor maybe once or twice in the last 12 months. I like the doctor that I have here. We moved from Nebraska a year ago in December, so we had to find new doctors and new hospitals. My husband has a lot more health problems than I do, but I've been very pleased with the doctor that I was able to find here, and
Good, so you've had some
good
good
experiences.
experiences. Okay, great, and we'll talk more about those in depth. Ralph, welcome. Tell us a little about yourself.
I'm in the same school as Esther. I tell my doctor I don't believe in doctors, but she makes me come back once a year.
That's it.
I'm sure they love to hear that.
And last time was about 3 months ago. I saw my doctor and a vampire, and she took some blood from me. So I saw 2 people.
All right, well, good. And how did you feel about
It was
that
good.
experience?
It was
Good?
Just a typical wellness check, well check, whatever they call it.
Great, all right, thank you. Anne?
I see my doctor every 6 months, and I think he's wonderful. And I saw him yesterday.
Terrific. Well, that was a fresh experience for you. And again, good, bad, somewhere in between?
Oh, he's superior. Truly. He's up in Dayton. I drove all the way up there because I moved down here, and I just can't say no. I just can't believe him because he's that wonderful.
Great. Well, good. Well, thank you to all of you for giving me a little bit of a sense of who you are and just very broadly some of your experiences, which we're going to talk more in depth. But what I'd like to say, so now that we're all friends and we've all met each other here, I want everyone to feel very comfortable in offering up your experiences and your thoughts. And because we're all friends now, as friends do, we tend to sometimes agree with each other and sometimes we disagree with each other. And that's okay. So I want to make sure that we have a variety of thoughts and opinions as we go through our discussion. And I, by no means, will be asking more in-depth questions about any of your personal experiences in terms of health conditions or anything like that. I don't want you to feel that you need to divulge any of that. If you want to, you're more than welcome to tell us a little bit more, but I don't want to feel that that I'm prying into anything personal, because that's not why I'm here. But certainly compassionate about the fact that some people have had some different types of health experiences, but don't want you to feel that you need to say any more than you feel comfortable doing, okay? So now that we've got that all under control, now we're going to talk a little bit about, so again, we know we're talking about healthcare, but what I would like to know from you, just kind of broadly, when you hear the term healthcare, just give me some words that come to mind. What are some of your general thoughts and just kind of quick hit words? Who would like to start?
Doctors, hospitals.
Okay.
Emergencies.
Insurance.
Politicians.
Politicians? Okay.
That's not something.
I'm sorry?
Good look on.
Esther, I'm sorry, did you have a word, a thought?
What did I say, anything? No, I didn't.
Oh, I thought you said something, my apologies. What other words come to mind when you think about your last experience?
Coverage, maybe you can say that.
I'm sorry?
Covers under the healthcare.
I'm sorry.
Yeah, coverage.
Oh, coverage, okay.
It's my accent.
It's okay. I have one too, I'm from Chicago, I'm sure I have
I change it every time.
Exercise.
Exercise, okay.
Excellent. That keeps me going.
Think of some of the words that you used as you were introducing yourselves and some of the things that you talked about with regard to your last experiences with your physicians. Medications. Okay.
Those were hospitals. Dollars.
Sorry?
Dollars.
Dollars. Harold, you talked a little bit about some of the folks that you've seen and the types of physicians you've seen. Again, just some words or sentiments over how you felt about those interactions.
They're all fine. I mean, I've seen my ENT since he became a doctor. He took over, came into this practice, and he made house calls to my wife when he first came to practice, and so how the goal was. So we get along very well. Same thing with my family doctor, same thing, get along very well. How are you today? How's this? How's your knee? You know, these types of things,
Okay.
and so forth. So, yeah, we get along well.
Any other thoughts, words?
Specialists.
Specialists? All right. What about some of the kind of general feelings as you're kind of preparing for an office visit or while you're in the office? What are you thinking or feeling about your time with a clinical person or someone in a physician's office?
Well, sometimes I thought about here I go again, another time. Other times it's, I hope they get it right so they don't make any mistakes and create problems.
And I don't guarantee I'm a good drawer, writer, speller, nothing. So if you can get it, good. I'm just going to move this over here.
Doctors good, office staff
Would it be okay if I put this on this side? Would this be all right for everyone? That's what happens when you discover bad glue. Things can stick anywhere. Ralph, tell me
bad.
again what
Doctors
you
good,
just said.
or office staff bad.
Okay, doctors, good. Staff, bad. All right,
Side effects.
side effects? And we'll talk more in depth about this, just want to get some general thoughts at this point.
I haven't had the experience here, but previously when I would see doctors, sometimes you were waiting in the waiting room for an hour or longer.
That's right. I wasn't know for the doctor, the staff is just horribly incompetent.
Mhm.
And she's tripled it, which made it 3 times worse.
So this kind of idea here, doctor, staff, waiting, Any of this spurring other ideas with any of you?
There's support personnel, right? More than just office staff, there's the other support. Like I'm thinking
Like who?
hospitals, maintenance people, nurses, nurses' aides, that sort of thing. Do they still have candy stripers?
I believe they do. I believe they do. I think they're just plain old volunteers these days, but I think they do. Maintenance volunteers, I'm sorry, Ralph, who was the other person? You
Nurses
said
was one.
nurses.
Nurses.
Okay.
About research.
Research in what way?
Tests that have been done, testing that could be done, FDA
Okay.
approvals. You know, the most recent thing is the one that I saw on TV the other day about mammograms. One research study just came out and said they're not necessary. Another one came out and said they still should be done, these types of things. It happens with every medication. Sometimes you can't get medications because the FDA hasn't approved it or something. The doctor wants to give them to you, but he can't. All different types of things of that nature.
Okay. What other words? So a doctor's office, a hospital, where else might you have had care outside of that? Any other places that you can speak to, kind of singular thoughts on your experience?
I visited an urgent care one time with a migraine headache. That's part of my only experience someplace other than a hospital or a doctor's office.
Okay. And what were you kind of thinking about that experience?
Couldn't wait to get rid of the headache. Seemed like it took a long time for me to be seen.
So back
But
to,
the medication that they
waiting
gave me
time?
was effective.
which waiting? Sorry, here, right here.
Yeah. But the medication was effective, so I was pleased with that.
Nursing homes.
Yeah.
Hospice.
Go ahead and put this one over here. Okay, we're going to refer to these pages during the course of our conversation. So, sounds like we've definitely had some experience and variety of levels of experiences with physicians and healthcare facilities, et cetera. What I'd like to get a deeper sense of is more about your last visit or a visit that kind of bubbles up to the top in terms of things that you remember very vividly or kind of stand out for you in the visits that you've had. So in some of the visits that you have gone to in the past, give me a sense of, do you have expectations of what you think your visit with a clinical person or a provider, do you have ideas of what is it going to be like when you get there? Do you have some thoughts around that? You're driving to the doctor's office and what's going through your head? Do you have an idea of how you think the visit's going to go?
I think I'm generally optimistic about my visits with doctors based on my previous experience.
Optimistic, okay. Other thoughts around getting in the car and going to the doctor and here's what I think is going to happen.
I think the word routine.
Routine, okay.
Friendly.
Friendly.
Old magazines.
Old magazines, okay.
Or none.
Or those that I don't want to read.
So I carry my own crossword puzzle.
There you go.
And you'd be looking at old magazines, why?
Because I'm waiting.
Because you're
Yeah.
waiting, okay.
And I know I'm gonna be waiting, I should brought a book.
So this idea of waiting has come up a few times already. So,
That's why I do early appointments, like.
early
help to avoid
appointments.
that.
Okay.
Learn some of the secrets.
Take the first appointment in the morning and the one right after lunch or something.
So this idea of waiting, what does that do to you?
They put me in a little room, and I waited and waited and waited, and finally I decided I was just gonna leave. So I got up, and as I pulled open the door, the doctor was standing on the other side, and I scared him to death.
You scared him, I bet that was a
He was
switch.
just ready to come in,
Yeah,
and
at the
there's,
door.
yeah, then I was there at the door.
So tell me about this little room, what kind of
Well,
room was it?
they take you from the front room and stick you back in the little
To
rooms.
the examining room.
Yeah, and then you wait and wait and wait, and you think, oh, they forgot me.
Yes.
And you know they put your chart outside in that
Yeah.
thing, and so you just wait and wait.
Were there old magazines in that room too?
Mhm.
Who else has had that kind of experience? Waiting in the
There's never
exam
been
room?
magazines in that room. It's
No, you
always
have to
a-
carry your
Always
own.
a chart
Bring
on how to
one with you.
recognize tonsillitis
Yeah.
in your child. How many times can you read that?
How long has anyone waited? What's the longest you've waited, either in the room or out in the waiting area?
3 days. It just
Feels
seems-
like it, right?
I think 2 hours is probably as long.
2 hours. Anyone else? Can anyone else beat that? No? How about others? How long have you waited? for
I was only
appointments?
in there 15 minutes, but I told him I was leaving. He said, oh, please don't leave. He said, I had an emergency. I thought, uh-huh.
So as you're waiting, is there anything going on in the meantime other than reading old magazines or your own? Are you seeing anyone in the meantime?
Well, first you have the nurse that comes in and does the preliminary
Takes your
stuff.
blood
Is
pressure
that
and
what you
all
mean?
that. Okay.
Yeah, take the blood pressure and temperature and ask you questions, need refills, and why are you here, all preliminary stuff, because he's only allocated 7 minutes to see you. And comes in and goes out real quick, depending on what you're there for.
So before that, before you get into the little room, it's kind of a scary thing to think about, the little room. So before you get there, and so you've gone to the doctor's office and you hopefully you found the building, you know where you need to go. What's the first thing that happens when you get there?
You check in.
Check in. Sign in. Look at that, we've talked so much, we're already done with the whole chart. Oh, let me make sure the last one doesn't go anywhere.
Wow.
Okay. So, check in. Who says that's the first thing we do? Esther? Yes, no?
I had none of those problems.
But when you get
come to the doctor's
I
office,
go into the office, I sign in, and in a few minutes, maybe 5-7 minutes, they call me, and then they start, to check in whatever, and then in 5 minutes or so, the doctor comes in, talks to me, I tell him what I want to know, or he tells me certain things on that script.
But you had to sign in and give them your name.
Yeah,
Right?
first you
Okay.
sign in.
Everyone's done that? Okay, so, first step. Check in. So tell me more about what happens at this check-in process and what is it like? What do you have to do?
They check your
You
coverage.
sit down
Yeah.
and people
Who's-
come
who's
in
gonna
and
pay?
go in.
Who's going to pay?
yeah.
Who else has this happen at check-in? Check your coverage?
Yeah, I was gonna see.
And?
Insurance card.
Well, the
Insurance
first thing they
card?
say is they want your insurance card and your driver's license.
for the 13th.
How does that work for you?
And if there's any changes in your address or phone number, it's also yes.
And go-away.
And copay. So as you're going through this process, what are you thinking? What's going through your head at this point?
It's routine, happens at every
Just
office.
routine? Okay. Do they, people at the office, do they do it well?
So sometimes I get in and then they ask me if everything is the same. I'm living in 40 years in the same place. Everything is old like me, so I said everything is the same, so don't bother me.
What are these folks like? You know, where are these people stationed? Where are these folks that have to check your cover? And where are they when you walk into
Well,
the
that's
office?
the window. When you get in, there is a room
What do
and
you
there is
call
a
it?
window where you check in.
Yes.
And are they, what are they? What's their position? Do they look like they're,
Some are
clinical
secretaries.
people, or what do they look
Well,
like?
some act like secretaries, some act
Mhm.
like they're medical assistants or whatever,
Okay,
just depends.
nice. Who else has the nice experience?
Good where I am now.
The biggest problem is having to fill out or sign that you read the HIPAA thing every time. That gets to be old hat.
I do have issues with HIPAA.
Well, everybody does. but
How's
it's not-
that?
My mother had Alzheimer's before she passed away. One Christmas, she was gonna go and spend Christmas at my sister's, and I had to fly with her to South Carolina. And then I flew back home, and then I went back to pick her up at the end of her visit and to bring her home again. She had pneumonia during her visit at my sister's and was hospitalized. And when I was trying to find out, because she was still in the hospital, you know, like up to the day before I was coming to get her, when I tried to find out from the hospital whether it was even advisable for her to travel, they wouldn't tell me anything because of HIPAA. I have a daughter who's an RN, and she assured me that that's a bunch of baloney. They could too have told me that. They simply chose not to, because there's a wide range of how they can choose to interpret the HIPAA law.
Let's talk a little bit more about that as far as the interaction that you had with this particular clinical person in the hospital who, for whatever reason, wasn't able to give you information. With regard to information and how you get information, either from a physician's office or a hospital, where do you put that? Good, bad, somewhere in between? How do you communicate with the people who provide treatment to you or a family member?
For me, there's been a giant range from really bad experience. Most of my experiences are much better than that. Most of my experiences with getting information are, you know, good experiences.
And how does that happen? Who's doing it and kind of what is it? Where's it coming from?
Well, I guess I would chalk it up to the attitude of the other person. Couldn't possibly be me. Has to be the other person. The attitude of the
how?
person I'm speaking to.
Meaning?
Whether they are helpful or
Okay.
whether they are, you know, refusing to give me the information that I need.
So in this particular case, this person was not
Was
particularly
not helpful.
Okay.
And had a very rude attitude. I did find out afterwards that my brother-in-law, who's an attorney, had represented a client who was suing that hospital. So maybe that had something to do with it, I don't know. But I was treated not well.
Not well. Who else? Has anyone else had an experience like that where you felt someone from a hospital or a physician's office was either not helpful or, as Joy said, potentially rude?
I think my experience has been, you have to ask the proactive approach. That if you don't ask, they don't always volunteer information, they don't always tell you what's
Right.
coming next.
Sometimes
what's
when
gonna
you
be.
ask, they won't give you the information anyway.
I haven't
And
had
Harold,
that-
you had said that, excuse me, I'm sorry.
Yeah, I haven't had that kind of experience, other than, you know, if I don't ask, I don't really
Yeah, because
expect
they
an
don't.
answer. So I haven't been refused information, I just, sometimes I forget to ask, sometimes I don't ask the right questions in the right way, and I put that on me, every now and then.
Harold, you had mentioned that you felt you needed to be more proactive as well.
Well, that was, you know, specifically with the medications or whatever, should I continue to take this, et cetera. But
With this aspect, I know that, especially if you go to see a new doctor, they have a form you fill out, and you authorize certain individuals to receive information on your status. And whether you want the phone calls, whether you want a message to be left if they call on the status, or if you know, and you mark off how you want my status to be given to whoever is asking. So before when I had to go see my surgeon for this particular thing, you know, you put in all the names, and I had my wife and my daughter-in-law and my daughter, whatever, so that if any of them call, they're on the list, they can get my status. You know, they can go see the doctor and they can tell them what's going on and what's not. If you don't fill those things out, you know, then you can't find out. And in her situation, it's completely different situation.
Yeah.
And you do run into those types of things.
Do you think there's a connection between that list and the person that answers the phone? The list is over here in a file.
not necessarily, that's true, but as long as they have it in the file, then they'll give you the information on what your status is.
Ralph, talk a little bit more about what you just mentioned,
Well, it's
about the person on the
bureaucracy.
phone.
You know, you fill out some, these people have permission, okay? So it's easier for the hospitals, whoever answers the phone, just say, well, I can't give out that information, even though that you might be on the list. The person answering the phone is nowhere near the list.
Right, you have to go to the doctor
Yeah, right.
specifically and ask if,
Yeah, try calling the hospital and ask the condition of your friend, or they're stable.
oh, forget it.
Yeah.
So with this theme here, thinking about how we have to be more proactive and taking on some of this ourselves, how does that make you feel? Is this something that you feel you should be doing or have to be doing? And what are you thinking is your feeling? I've got to take all this on myself.
You all are gonna think I'm just nothing but a troublemaker, bad attitude, because I'm gonna bring up something else. My husband has hearing issues, and he is supposed to wear a hearing aid, but he doesn't. And many times he will want me to call either his doctor's office or the mail order thing that he gets his prescriptions through, because I can hear them. But often they won't talk to me because they don't have down that I'm supposed to be someone that they can speak to. I know that sometimes there is something on a sheet of paper that you can put down that it's okay to speak to this person, or it's okay to leave a message on an answering machine. But a lot of times there isn't any spot where you are supposed to put something in. If you don't think about it and tell the person, and then like with this mail order thing, I don't know that there's any kind of paperwork on that where he would have had an opportunity to give them my name and say, yes, you can speak with her.
Right.
I just feel like it's more difficult to do the things that you need to do because there's this roadblock of privacy.
So roadblock, is privacy a bad thing?
I think that privacy is a great thing, but I'm amazed at the things that the government thinks that we need to have privacy about. We don't have any right to privacy when it comes to what information is about us on the internet. We don't have any right to privacy when people can just call us at all hours of the day and night, just getting our phone number from anywhere. They don't know us, they want to sell us something. They want to, and there's all kinds of scams, you know.
So that privacy thing, the HIPAA thing that we talked about, is, you know, we see that as part of the upfront check-in process, and it sounds like from a healthcare standpoint, that's just what we do. But as we check in, we're at the office, we've checked in, and now the next part happens. So what's the next part of the process of when we see a doctor? What comes next? In your experiences, you've checked in?
Back to the small room.
Back to the little room, okay.
Back to the small room. They take you into the small room and then,
Do you go right from checking in to the small room?
well, not the same moment.
What happens before that?
You go back to waiting.
You wait till they call
Back to
you.
waiting. Who else says
Waiting to be called.
waiting? And where are we waiting at this point?
In the waiting room.
All right. And what's this room like? What is your experience in terms of what the room is like? What does it look like?
Uncomfortable chairs, bad magazines.
Chairs, table, magazine, lamps, whatever.
I'm sorry?
It's usually either too loud or you can't hear it at all.
No, Esther, you said?
No, I mean, I don't have that experience. It's a nice room, chairs,
Okay.
tables, lamps, magazines,
So it's
or
nice if there's a window, isn't it?
whatever. You know, in mine, they have been plenty windows.
That's nice.
Ian, how about you? What's your waiting experience like?
Nice. I like magazines.
You like magazines? What else is nice about it?
It's just time to sit down for a minute.
Sorry?
Just doesn't bother me to sit and wait for a minute out there. I don't like, I'd rather be out there than back in that other room. What
do you not like about the
I'd
other
rather
room?
they let me stay out there than stick me back in that other room for the 15. I'd rather they just let me stay out there.
What's different between this room and the other room?
Well, the other room, you don't know if they did forget you. I swear I thought they forgot me.
Did they forget you? Okay.
Separate us so we don't cry.
Yeah.
And as we get to the next step and we are sitting in the little room, is someone coming in and out? Do you know what's going on? When do you kind of start to feel, kind of wondering what's going on?
About 10 minutes.
10 minutes? Okay. And what's this exam room experience like as you're waiting? What's happening at that point?
Nothing at this point.
What's the room like?
Well, the room when I go, I like to go in when they call and come to, because that means that I'm closer. And there is that room where the doctor comes in and asks the question, and it's a nice room. One side is mine, one side is all window, and then the table, if you have to lay down on a chair.
Uh-huh.
I mean, what else is there? Where they wash his hand and that's it.
How many people are in the room?
No,
in the
it
exam
it
room?
has to be only you and a doctor and maybe the nurse, it depends what's going
Okay,
on.
so nurse, doctor. And by this point, who else have you interacted with?
Only the nurse, in my case.
Okay, who else? Who else have you interacted with when you get to the office?
Somebody guides you back to the room, that's it.
And who is that person
Some
typically?
other clerical staff.
Okay. What do we like about these people? What do you like about the staff that's up in front?
I like my nurse, the rich one comes in and she's a little bit heavy and I'm working on her to lose weight. This is the conversation. And then she asks me whatever, you still taking the same medication.
Uh-huh.
If there is any, and check my blood pressure to see if it's changed. And then what else? If I ask for, I would like to have a blood test or something, and it's nothing special, then she can take that. if it happens, you know, doctor will be, if not, then she's out. And that's later, my doctor comes in, and if it happened to be on call or whatever, the nurse comes in,
So someone is coming into your room and letting you know
yeah,
when you might expect the doctor
one
to
more
come
minute,
in.
and
That's
then,
nice.
yeah,
Okay.
because he's on the phone for a call, which one is important, probably from the
All right.
hospital or whatever, because sometimes happen when I am on visit, they call in and they say, you have to take this call because it's from the.
Yes.
So
Hospital.
what do you feel about that when someone comes in to tell you the doctor will be in 4 more minutes?
I think it's important, it's not a special private call, let's say, you know, from whatever. And if I would be in the other side, I would like him to take the call. That's the way I feel.
Okay. Has anyone else had that experience?
But then again,
Sure.
again, maybe I would feel different if I would be sick. Because we are restless when we are sick.
Mhm. So in this particular situation, it was kind of a routine visit for you, or what was different? You're saying if you were
I would
sick,
feel different,
You would
I
feel
would
different?
feel more restless.
restless, okay?
Why he have to take the call. But I always think about he takes the call because it's important.
Thank you.
And it never take too long,
Okay.
so fine.
Has anyone else had that experience where someone has come along and let you know roughly how long it might be to see the doctor?
Never.
I think that might have happened maybe once when I waited for a long time.
So again, as you're sitting and waiting in the little room, give me a sense a little bit more about your physical being. Do they make you do anything when you get into the room?
You still can have a magazine if you want to. What else is
A lot
that?
of times they have you take off your clothes.
Okay.
And then they lower the temperature.
Yes, they do.
So if that happens, then how is that making you feel in comparison to some of the other experiences you've had in the office prior to getting into the room?
Well, if you're full of germs, I suppose they ought to take you out of the big room and stick you in the little room, because that way the other people aren't contaminated by you. So I see that, but they still just, I'm starting to think that the next time after this last one where I popped up and did that to the doctor, that I'm gonna ask to have my doors remain open, because then I don't feel like they, you know, and then I can stick my foot out or.
So leaving the door open, what would that do?
Well, at least
for
I
you?
wouldn't feel like they shut the door and they forgot about me.
Just get up and open the door.
Yeah, that would be good too. Okay, Harold.
Sometimes we're not proactive.
Yeah, exactly.
Do you ever ask how much longer, or, no?
I don't have a lot of patience, so when I'm in there, I try real hard not to be a bother.
What would it mean to be a bother?
To go out in the hall like I was going to and go home.
And someone had mentioned removing, take off your clothes and then they turn down the temperature. When that does happen, what are they giving you? If you're changing your clothes, what are you changing into?
Sometimes they just give you a paper thing going across your lap.
Paper? Anyone else have the paper experience?
Gown.
Gown?
That dermatologist does that. So it's right by.
Depends who.
So you get a paper gown to put on. and
No,
then
this
you
wasn't a
sit-
gown, it was just a piece of paper.
On the
Laid
bottom,
across your lap.
you have the top.
And what are your thoughts on paper gowns or gowns in general? As you're
I
sitting
like it
there?
better. Because afterwards they throw them up way after everybody, so I won't get any other people's germs.
Is it pleasant?
What is it?
Is it pleasant to sit in a
But it
gown?
won't be unpleasant.
To me, it
It's a
depends
clean
on,
piece of
Is it
paper.
okay for you? Is it okay for you to sit in a gown in the exam room?
To me, it depends on what you're there for. If
Right.
you're there for them to look at your body, then you're gonna have to do it at some point.
Right.
Whether it's 5 minutes before or 10 minutes before, whatever. If you're not there for that, then I guess it's a different issue. But if I'm going to my dermatologist and she's checking my entire body for skin cancer or whatever, I'm gonna have to do it. So, to me, it's okay.
So we've outlined, I think we've talked a good deal about the waiting aspect, about the experience of a provider visit, a visit with a doctor, or even if it was a hospital. We talked a little bit about what that check-in process is like. We've brought up some keywords like, what do we have here? We've got, we had rude and doctors are good, the staff is bad. If you had an opportunity, and I'd like to hear from all of you really, if you had an opportunity to have a heart-to-heart conversation with either your physician or say the office manager of your doctor's office, and if you could have a heart-to-heart conversation and tell them everything you could about, gee, it would be really great if we could make a physician experience better by, or this way. What would you want to say if you had that opportunity?
I had one instance where my doctor gave me some medications, and if you don't feel good in 3 days, call me. So I called back, the person answered the phone. Instead of putting me through to the doctor, he said, well, he'll call you. Took the message and said, he'll call you. Well, he never called back, because he never got the message. And the next time I went to see him, I told him that. He was upset about that. You know, I would have to talk to her. And when I went to talk to you, I want to talk to you. And even if he can't talk to me right now because he's got an emergency or whatever it is, if she takes a message, then he should be able to get the message and call me back. Whenever his schedule, one doctor had a schedule, call you back after he sees all his patients, you know, it's whatever. But we told the doctor, it doesn't do any good for me to call back because you're not getting the message. You know, it's your question about all total in the office or?
Anything that you might have encountered during your visit with your physician that maybe didn't sit with you well or just wasn't what you expected? So on your way to the doctor's office, you might have had an idea in your head as to what the visit might be like. And on your way out, maybe you're saying, boy, that visit would have been so much better if. So let's fill in the blank. What would be the if?
I think we've already decided that if they would just let us know, like Esther said, they told her it'd be 4 minutes more, he's a little delayed. If they would just keep us updated a little bit, I think from the conversation, we kind of came up with that.
And maybe some of the other aspects of a physician's office visit that we didn't talk about, maybe at the point of being in the exam room with the physician. Is there ever a time where you're thinking, boy, that could have gone better if only fill in the blank?
I think that when the doctor makes you feel like they're really listening to what you have to say, that is something that makes a real difference in how I feel that visit has gone. If I feel like the doctor, you know, just kind of rushed in and out and didn't even look at me, that isn't a good feeling.
So listening.
Listening, yeah, and having time if I have questions to answer them completely.